Welcome to video 19 of the endocrine system for anatomy and physiology. We are looking at diabetes today, and the formal name is diabetes mellitus. And you've probably heard of this. It is extremely common, especially in the Western culture, due to a lot of dietary issues. And we're going to see that there are three types of diabetes: type 1, type 2, and gestational. Type 1 is also called insulin dependent. So people that have insulin pumps or have to inject insulin have type 1 diabetes. And in this case, there is a decrease in insulin secretion. Sometimes it is completely absent, so there is no insulin secretion. And this sometimes it's called juvenile diabetes because it usually manifests when people are younger, but adults can also develop this disease. And they think that this is autoimmune. So it's autoimmune destruction of the pancreatic islets. So those islets are destroyed by the body, and if they're destroyed, they can no longer make insulin. Type 2 diabetes, non-insulin dependent, usually is going to be something that manifests later in adulthood, and there are a lot of risk factors for this: excess weight, non-exercise, poor diet. They can all lead to type 2 diabetes. And this is where we have insulin resistance. And what that means is we have the inability of tissues to respond to insulin. So the body is still making insulin. The pancreas, the islet cells can make the insulin, but the tissues do not respond to this hormone. And that is due to a decrease in the number of insulin receptors. Or sometimes there are defective enzymes. Type 2 diabetes is on the increase in the United States. There are a lot of people that develop this, usually late 40s into their 50s. It's controlled by medicine, or can be controlled by medicine, but also can be controlled by diet and losing excess weight. The third type is gestational. And this is what happens to women who are pregnant. And this is insulin resistance caused by enzymes released by the placenta. And this usually goes away after birth. But it doesn't always. And usually women who have had gestational diabetes in one pregnancy are very susceptible to having it again, and it can increase their odds of developing type 2 diabetes later on in life. We turn the page, we have a couple more situations that deal with the pancreatic enzyme or hormones. Hyperglycemia. So we see the word hyper in there. We know that hyper means higher. This is abnormally high blood glucose levels. And This means that glucose is not entering the cells normally. And if we have an increase in glucagon destruction or conversion into glucose, that can also happen here and cause hyperglycemia. The symptoms are polyuria, which is an increase in urine volume. And we have polydipsia, which is increase in thirst. So one way of determining this is testing urine for glucose levels, because if we have too much glucose in our body, we can excrete that through our urine. And this is really gross, but one way that doctors used to be able to tell if somebody had diabetes and was producing or had high blood glucose levels is they would taste people's urine, and if it tasted sweet, they knew that it was a hyperglycemia, that they had something wrong with their blood glucose. But it really does increase the thirst and urine volume. So we're talking, almost every half hour to hour having to void your bladder. The opposite of this is hypoglycemia, and that is an emergent event. So the blood glucose levels go down too low. It can really, that can mean death if it's not treated immediately. So a lot of people will have glucose tablets or glucagon injections if they've had a lot of hypoglycemic events. That is a dangerous situation. So that would be hypoglycemia. Diabetic ketoacidosis. Here we have basically three different conditions. We have hyperglycemia, we just talked about. We have ketosis, which we'll describe here in a second, and acidosis. So ketosis is high levels of ketones in the blood. And that's due to those fatty acids being broken down. And acidosis is a decrease in the pH of blood, because ketones are acidic in nature. And if the pH decreases too much, our blood does have a buffer system in it that helps us with small changes in pH, but big changes in pH can also be deadly. The last thing that we'll talk about is insulin shock. And insulin shock, we have too much insulin relative to blood glucose. So this is a huge decrease in blood glucose. This can cause disorientation, confusion, coma, and in severe cases, death. So this would be what would happen if you were in hypoglycemia and your blood sugar crashed big time. Your body is producing insulin still, but there's very little blood glucose, and it keeps on getting used up because your brain needs it. Your brain is going to cause disorientation, confusion, hypoglycemia. You can start getting very warm, you start sweating, you're clammy. It's not a very fun situation at all. So those are some of the different things that can happen with changes in insulin levels.